Hello everyone, and welcome to the channel, Ask Your Pharmacist. Today we will be reviewing a medicine, which is used to treat chronic constipation. The medicine, which we will discuss is Duphalac. We will discuss Duphalac uses, dose for children and adults, side effects and special instruction and condition in which it should not be used. So stick around, and do like and subscribe the channel. Duphalac syrup contains active ingredient lactulose, which is a laxative used to treat chronic constipation. Duphalac syrup works by pulling the water content from body into the stool, making it soft and easy to pass by. Now the main question is, how to use Duphalac syrup. We will show you a chart, which will explain doses from infants to adults. In chart, you will see two doses. One is initial dose, which can be given for the first 3 days. And the next is maintenance dose, which can be continued after the first 3 days. This is because Duphalac can take up to 48 hours to act, so it may take 2 or 3 days before you feel the full benefit. After 3 days, you need to take maintenance dose, in order to keep your bowel movement normal. For infants under 1 year, dose is 5 milliliters daily. Similarly, maintenance dose is also up to 5 milliliters. For children 1 to 6 years, starting daily dose is 5 to 10 milliliters. Remember, 10 milliliters is the maximum limit you can give. And maintenance dose is 5 to 10 milliliters. For children 7 to 14 years, initial dose for first 3 days is 15 milliliters daily. Duphalac also comes in sachet form. 1 sachet is 15 milliliters, which means you can take 1 sachet, or if taking syrup, then take 15 milliliters. Similarly, maintenance dose is 10 to 15 milliliters daily. For adults, starting dose is 15 to 45 milliliters daily, whereas maintenance dose is 15 to 30 milliliters daily. Remember, Duphalac is also used for hepatic encephalopathy, whose dose is 30 to 45 milliliters daily. Also note that, drink a lot of water. Because Duphalac action, as we told, is to pull the water content from the body, and also eat fiber in your diet. There are few side effects, which may or may not happen to you, which includes diarrhea, excessive bowel activity, nausea or vomiting, abdominal pain and cramps, belching, excessive gas in stomach, low potassium and magnesium levels in the blood. Do not take Duphalac under following condition. If you are so constipated that you think you may have a blockage, if you are unable to digest milk sugar, if you have diabetes, if it is intended for a child, always consult healthcare and then give this. At last, you should always know, lactulose can take up to 48 hours to act. So it may take 2 or 3 days before you feel the full benefit. However, if after several days you do not feel your symptoms are improving, or if they get worse, you should speak with a doctor for further medical advice. There is also complete video on home remedies to treat constipation. You can also watch that. Link is in the end, and also on I button. The information provided here is by a pharmacist. We gather all the information from relevant sources and then present it in front of you. Hopefully these videos are helping you. Do like and subscribe the channel. And if you have any question, just drop below, we will answer that.